Okay, welcome to Life Skills TTP. This is episode 40. And this week I'm going to get my energy up. We're going to talk about the deinstitutionalization. And if you don't know what that is the mental health from the 1940s. Overcrowding crisis in state mental hospitals housed about 500,000 plus patients, often in deplorable conditions. The World War II impact. And then from the 1950s to the 1960s, the shift begins. And the catalyst for this, and I just want to say, basically why I'm doing this. If you've been watching this channel, I explained to you my sister passing away. I did not tell you about my cousin who died of an overdose, and she also had mental health issues. My life is intertwined with a lot of that type of stuff, and so I thought episode 40 I would get back to the basics and why I do this channel and what my journey is about. My journey, how I got myself together, was through programs and was through mental health. Me. I don't actually advertise it or put it on the channel like that. If you click into my link tree, a lot of you, if you're trying to seek some of that kind of assistance, click my link tree. I got contact forms. You can contact me in there anytime. But I'll get back to why I'm doing this. So when I was in school getting my degree, I was thinking about this as my dissertation, but a paper, I was just thinking about doing a paper. And I ended up doing the Central Part 5 instead. I remember that clearly. But I wanted to get back to this because this is important. This time frame and the timeline of this, and when they got rid of these asylums and pushed these people into the streets, a lot of them escaped. I'm going to give you names, famous names of serial killers and people who escaped from these places. And they didn't really tell you at the same time they had put the drugs and crack on the street. This stuff. And what they did is they switched it from actually mental health care to building prisons. And so I'm going to give you the timeline as far as 1950 to 1960, it was the medication revolution. And so they had chlorazepine, thorazine, and things like that. The Community Mental Health Act of 1963, JFK, signed a landmark legislation called for 2,000 community mental health centers. Goal, replace hospital and local care. So they were all on this stuff. But the problem was funding. It never materialized. Only 700 centers built, not 2,000. And the state closed these hospitals quickly. Cost-saving measures. I'm going to give you another theory because asylums are different from regular mental health facilities. And also people, when they hear mental health, it's a trigger word to stay away. Oh, they're crazy, this and that. When you're dealing with, there's different levels of patients, there's different levels of individuals that have issues, psychosis and things like that. So what I'm talking about, the deinstitutionalization, this is the worst of the worst. These were asylums. And what actually happened was the psychiatric hospital population dropped from about 559,000 in 1955 to 338,000 in 1970. Many patients dumped into communities unprepared to help them. So this is episode 40, part 1. I'm going to do part 2, and I'm going to start with the individuals I think that escaped and they didn't say nothing that became serial killers. And I'm going to give you the names of the individuals who actually did escape and committed some horrible crimes. Because I think this is important. I think at that particular time in the 80s, which was the golden age of serial killers, and the drugs and all that, I believe this got lost. And a lot of these people were living in the woods. A lot of these people were on the street. A lot of these people ended up to live, have children, and certain things. And they know this. And this is a important part of history. And so this is part 1, Deinstitutionalization. And I'm going to do part 2 shortly. I appreciate your time.